Before Medicaid expansion, Virginia had one of the stingiest state healthcare programs in the country. Safety net hospitals like UVA are legally and morally obligated to give free service to people admitted to the emergency room, but this often comes at a great cost to the taxpayers.
When people walk into an emergency room in a hospital, they have to be stabilized regardless of their ability to pay. Now, we know that people who are uninsured get about half the amount of health care as people who are fully insured, but they often enter the healthcare system sicker and require greater services.
For free clinics, moving patients onto primary providers can free up their care for those who still slip through the cracks. Colleen Keller, Executive Director of the Charlottesville Free Clinic.
We have been at capacity for a while, and we can't reach out into neighborhoods where they still don't have access to primary care and may not know about us. And there are 12,000 people in Charlottesville and Albemarle that are uninsured, 12,000 adults, which is a significant number.
In Virginia, a mom or a dad with 2 kids would not be eligible for Medicaid if their income was any more than $9,700. Now, I don't know about you, but I don't know any family of 3 that can live on $9,700.
However, the recent passage of Medicaid expansion will change the game for 400,000 uninsured Virginians.
For a third of our patients, they'll have hospitalization coverage. I mean, something that could cost you $15,000.
Virginia is now the 33rd state to offer Medicaid. But for the past 5 years, the Republicans have blocked this expansion. We asked Virginia delegate David Toscano why it passed in 2018 when it had failed 4 times before.
What changed was an election in last November where Democrats got 15 more seats and we got to 49. Once we got to 49, I think the Republicans woke up and said, we need to worry about this issue. Healthcare was the #1 issue in the fall election. And I think people paid attention and they changed their minds accordingly.
Tens of thousands of Virginians will now be better off starting in January, both health-wise and financially. But most Republicans opposed Medicaid expansion because they worried that federal promises to pay for it can't be trusted. We asked Toscano about that.
Well, fiscal pressure always concerns me. And the good news is that the federal government is picking up 90 cents of every dollar that we're spending on Medicaid, and the hospitals are picking up the rest. So the cost to expand essentially is 0 for Virginia. Everybody who qualifies for Medicaid now in Virginia will be subject to what's called managed care. We will be watching the care that gets delivered to them. We will be trying to provide them with a doctor so they don't have to always go to the emergency room. We'll be monitoring their prescriptions to make sure that they're going to be buying the least expensive prescriptions that do what needs to be done. So we're going to be trying to rein in the costs that way.
Medicaid expansion will come into effect this January. For WUVA News, I'm Bryn Jefferson.